Alright, okay. Okay, so hello dears, and hello. Okay, so welcome to yet again another pre-recorded lecture in our class in immunology and serology. And for this lecture, what we're going to discuss now is one again, one of the many applications of our subject, especially serology, in the diagnosis of disease. And for this lecture, the disease that we'll be focusing are the diseases that are caused by your Epstein-Barr virus, all right, or your EBV, ayan. So, okay, your Epstein-Barr virus serology. Okay, so we'll go now to the different tests that we can test to diagnose the diseases caused by your EBV, ayan. So, medyo, yes, virology is waving. Mga first sem, mga war flashbacks, charot. Okay, so, again, mga virology lang na review. But we'll not be focusing on the characteristics of the virus, no, just an overview. And then what we're going to focus now are the serology, okay, behind the diagnosis of EBV diseases. Okay? Alright, so again, this is Epstein-Barr virus serology. Bakit kaya ganito ang background? Okay? Ayan, so, as in, kanina guy, nadyo kayo ma-remember niya na friend na ako, na friend po sa uban ninyo dara, na ako makakaila dyan. As in, whenever I see this guy, makatawa ko kayo, ma-remind ko sa iyang nawong. Okay. Anyway, alright, so again, ngano dagay inani ang ato ang background. Ooh, ngano dagay. Anyway, alright, so again, we'll start first with your EBV, the virus itself. Your virus is again a member of the herpes viridae family, so therefore it's a herpes viridae, which means it's a, unsa man, RNA or DNA? It's a DNA virus. It has a protein capsid and an outer envelope, so it's enveloped, di ba? So, I'm not sure kung saan na mnemonic ang gihatag ni Ma'am Fudge for you, but my mnemonic for the DNA viruses is Papa, Ad, Po, He, He. O, di ba? So you have the Parvoviridae, the Parvoviridae, the Papova na ba? I think. You have Adeno, the Pox, the Herpes viridae, and of course, the Hepa, the DNA viridae family. So sila ang mga DNA virus, di ba? If nakay-crush sa Facebook, magpapa-add po, hehe, char. Okay, di ba? So yes, these are the members of your herpes viridae family, the DNA viruses. And all of the rest of the virus families, no, outside of the papa-add po, hehe, are the RNA viruses. Okay, so mga kato na mga coronaviridae, yes, COVID, you have SARS-CoV-2, you have mga Flavi, you have Bunya, and all that. Okay, anyway, that's a viro na yan. Tapos na yan, war flashbacks. Okay, so again, DNA virus. Okay, enveloped. All right. These viruses, they can cause latent infections, meaning latent, they are there, but they do not cause any disease. Latent, it's just dormant, latent lang, nandyan. Pero hindi talaga siya nagpaparamdam. What? Okay, alright. With lifelong persistence in the host. And again, herpes viridae. The very characteristic of the herpes viridae is the latency nila na ilahang characteristic, okay? Or their ability to be latent, meaning to be just there, no, it's in your body, but they do not cause any disease, okay? Or wala sila nagparamdam ba? For you to say na, okay, I have this virus, or okay, nako infection caused by this virus, ganun. Okay, and again, 8 viruses. You have HSV1, HSV2, varicella zoster, yes, mga measles, chickenpox, yes, and you have shingles, di ba? Epstein-Barr is HHV4, cytomegalovirus, and HHV6, 7, and 8. Okay. Epstein-Barr virus is your HHV4, human herpes viridae virus number 4, and CMV is your number 5. CMV, I don't know lang if na-mention po ni sa inyong viro, but please take note, CMV is considered to be the most common congenital infection. Ayan, lumalabas sa boards. Okay? Most common congenital infection, meaning mga infections that are acquired or that can cause, or the infections that the developing fetus can have. Okay, di ba? They are a member of, unsa man, katong torch. Hala, na-remember po ba ang torch? Okay? Kung sa meaning sa torch, you have toxoplasma, rubella, cytomegalovirus, and H stands for, di ba, nalimot na ko. I think it's hepatitis. Tama ba? Torch? Okay? Torch? Hepatitis ba? Yes, Mark. or herpes. Basta, okay, anyway, alright, basta torch. C ang very important because it's the most common congenital infection, CMV. Okay, please take note. Naku, lumalabas sa boards. Alright, okay, that's for the introduction to the virus. And this is now its characteristic. Again, it's enveloped. DNA ang genetic material. And of course, it has a protein, capsid. Okay, of course. Ayan. Alright, okay. Now, for the transmission, it's usually through aerosols, no? Salivary secretions, droplets pala. Alright? And from an infected individual, meaning the individual has the EBV, and then nagchika siya, no? Yes, alam na this. And aside from that is through blood transfusion, bone marrow and organ transplant, sexual contact, and perinatal. Ayan, so ito, naku, na-blurred pa. Sana all. Sana all aluche, okay? Alright, ayan. So again, salivary secretions from infected individuals. Sana all. Nakakamiss. Charot! Joke lang! Mark, oh my God. Woo! Okay, alright. Ayan. Now for the diseases, EBV has a wide range of diseases, or it can cause a wide range of diseases. Starting first with, of course, the very common infectious mononucleosis, which is also known as your kissing disease. Bakit kaya? Because it can be transmitted through aluch, through kissing. Ayan, so it's very important sa mga active dyan, sa mga laging nadidiligan, sa mga laging may sores, no? Sa laging mga himaya sa langit, yes. Always make sure that your partner is clean, no? And that also, you yourself should also be clean. Alright, you're doing that for yourself and you're doing that also for your partner, okay? Alright, practice safe sex, everyone. Practice safe sexual activities, good. Alright? Medtech tayo. Alright, okay. Aside from that, it can cause also Burkitt lymphoma, which is a type of a malignancy then, no? Of the lymph nodes, yes. Malignant neoplasm of your B cells, common in African children, yes. Aside from that, it can also cause Hodgkin's lymphoma, diba? Also known as your Hodgkin's disease, cancer of the lymph node. Recalling your hematupan, I think. What's the characteristic cell sa Hodgkin's lymphoma? What is it? It's your, press the buzzer, dapat, ano? The Reed-Sternberg cell, diba? The owl eyes appearance na cell. Yes. So if you biopsy inyong mga lymph nodes, no? Kayo makita na owl eyes appearance of your cells sa lymph nodes, then that could be pathognomonic, meaning it really points to the Hodgkin's lymphoma or Hodgkin's disease. Okay. And last na yung makakause is other malignancies then. Alright, okay. Ayan. Alright. Lymphoma there, guys, no, diba? That's in your hematu then. Lymphoma versus leukemia. Lymphoma is more, it's concerned with the lymph nodes. So na ay malignant neoplasm in your lymph nodes. Whereas leukemia, it's generally a malignant neoplasm or malignant proliferative diseases of your myeloid or lymphoid na mga cells, diba? In the blood. Alright? Okay, ayan. So, I think na kaget siya mo sa difference, hopefully. Okay, alright. So again, these are some of the diseases that your EBV causes. Okay. Alright. So, other malignancies, pwede nasopharyngeal, meaning sa imuhang nasopharyngeal at the back of your nose, no? And squamous cell carcinoma, pwede sa skin. Okay, squamous cell carcinoma. Alright, now we focus now on the infectious mononucleosis because again, it's the most common. Alright? Ano naging most common? Because maraming mga active dyan. Masarap din naman, church. Markang kalat. Okay, I cannot, no, I'm not like, I cannot deny, I cannot lie din naman, no? It's good. It's good. Alright, anyway, alright, sorry guys, mga deprived, mga years na. Sorry kayo, no? My gosh, Mark. Sige lang. Tanggap ko na I think I'll be single. Tanggap ko na Jane, Wanda na. Magluluto lang ako ng leche flan every Saturday, every Christmas. Char. Okay, roof on me. Anyway, alright. Infectious mononucleosis, the most common infection due to EBV. Infants and young children can be asymptomatic or mild. And healthy adolescents or adults, symptomatic. Nako, ayan. So, sa mga ano dyan, active, alam nyo na. Always look out for the symptoms of IM. Okay. So what are the three classic symptoms? Fever, lymphadenopathy, and sore throat. Nako talaga. Fever, lymphadenopathy, and sore throat, pag yun. Actually guys, wala akong kachika, no? Positive kong ASO. Like, sa akong video, sa ASO, that was my sample. So, positive kong ASO. So, because I was really prone to sore throats. Woo! Kasi medyo active yung throat ko. No, mapush. Okay. Actually, I have an active throat. No, I mean like, medyo, ano talaga, I'm really prone to sore throats talaga. I mean like sa third year, when I was still a medic student, third year, I was like really prone with sore throats. Like, kapila ko si antibiotics. So, I think that was Epstein-Barr. That's why positive kog ASO. So, at least now you know that I have an antibody to streptolysin O. So, I think muna wala na kay kog sore throat karon. I have to thank my ASO for that. Kaya I think, yeah, they're really doing a good job in protecting me from Epstein-Barr because of my activities involving the throat. Like singing, no? Like talking. Come on, Jude. Basos mo. We're very active akong throat. Ato na tayo. Hi nako, Mark. Jesus Christ. Okay, anyway. Alright, so again, fever, lymphadenopathy, and sore throat. So as you can see, medyo dili defining iyahang symptoms, no? It could actually point out to a lot of other diseases, alright? But look out for this. Sa mga partners nyo dyan, mga active, sa mga willing to explore, to mingle, yes, look out for these symptoms. Nako, kung naana sila experience any fever, lymphadenopathy, pag yun, sore throat, nga ganan sila ano ninyo, nako, ekis, enk, talaga ekis. Thank you, next. Next lang na candidate. Alright, okay, look out for that. Okay. Ayan, okay. And other symptoms, splenomegaly, hepatomegaly, periorbital edema, fatigue, and myalgia, or myalgia, or muscle pain. Okay, if I'm not mistaken. So as you can see, ang ubang symptoms, di magud makita, no? So, kanya ang evident. Aside from fever and fatigue, no? So, always look out for that. I am. Ay, naku, Mark, nagkakalat ka na naman. Alright, so for lab findings of IM, so there is absolute lymphocytosis. So, greater than 50% ang total leukocytes and at least 10% ang atypical lymphocytes. So, why is it called atypical? It's because iyahang appearance, no? It's not the normal lymphocyte na spherical yun. Okay? So, it's characteristic of your infectious mononucleosis. And your atypical lymphocytes, if I'm not mistaken, and if sakto ba ko, remember pa ko, these are also known as your downy cells. I'm not sure lang if na by E or wala. I think na E. So downy cells or atypical reactive lymphocytes. If I'm not mistaken, I could be wrong. Okay, all right. And that's why it's called mononucleosis. There is an increase, no? There is an increase in our mononuclears. And it's not because of B cells or something. It's because of the taas na cytotoxic T cells. So because of the increase in the number of the cytotoxic T cells, because again, this is a viral disease, viral infection. So of course, mo increase mo cytotoxic T cells, and your cytotoxic T cells are your mononuclears, no? So, mutaas siya, mononucleosis. That's why it's termed mononucleosis. All right. And aside from that, it can also produce what we call your heterophil antibodies. That's what we're after, okay, in this lecture. So we'll discuss that in the next succeeding slides, ang heterophil antibodies. What are those? Okay, all right. And antibodies, of course, to EBV antigens. Antigens of the virus, okay. Now, we go na to the pathophysiology of your EBV. Your EBV, they infect cells, squamous epithelial cells, usually there is sa inyong throat, no? Or sa inyong nose, di ba? Nasopharyngeal, yes. And they are also infecting your B cells, okay? B cells ilang target that has what the receptor? CD21, okay? CD21 ilang target. Because this is known as the EBV receptor and also the receptor for C3d, okay? Which is, I think, a complement protein, if I'm not mistaken. All right, but anyway, CD21 ilang target na molecule, okay? And this is seen in, of course, B cells. All right. They initially affect again your epithelial cells in the oropharynx, okay? Oropharynx, okay? And they then infect after infecting the epithelial cells sa oropharynx, they then infect the B lymphocytes, which spread throughout your lympho-reticular system. Your B cells become polyclonally activated, meaning because they are B cells, and diba ang purpose of B cells, they can produce antibodies. So they are activated because of the presence of EBV. They then produce what they call your different antibodies, no? Pwedeng EBV-specific antibodies, no? Like antibodies that are really specific or attacking your EBV antigens. We can also have autoantibodies, yes, diba? Recall from our lecture on cold agglutinins, diba? Pwede siyang mag-release of unsa na antibody. Unsa to? Big I or small I? Anti-small I, diba? Atong mnemonic ana, okay? And pwede pong RF, diba? Recall po in our lecture in rheumatoid arthritis. RF is not specific for rheumatoid arthritis. So here, it can also, this disease also can also release RF and anti-nuclear antibodies. So anti-nuclear antibodies usually seen in autoimmune diseases. So anti-nuclear antibodies, antibodies that attack the nucleus or the nuclear components of your cells. Okay? All right. And aside from that is your heterophil antibodies. So again, we'll know later kung unsa ni mga heterophil antibodies. Kung sino yan sila. All right? Okay. Ayan. And EBV persists in the body indefinitely in a small percentage of B cell, latent infection. Gamay ra sila in numbers, but they are still present there. Gamay in numbers, they are small in numbers to the limit, or because they are small in numbers lang, di ra sila kakos og infection or kakos og ka-intense na infection. Okay. All right. Now, it could be reactivated because of viral shedding sa life cycle of the virus, diba? And genital secretions, periodic reactivation. So from time to time, pwedeng ma-reactivate ang virus, no, makabati siya po og symptoms ang patient, and all right? And some individuals develop also chronic active infections of EBV with severe, often life-threatening IM associated symptoms, kato mga fever, splenomegaly, lymph adenopathy, ganun. Okay. And again, as mentioned, it is also associated with several malignancies, both hematologic, Burkitt's lymphoma, Hodgkin's disease, and non-hematologic, nasopharyngeal carcinoma, squamous cell carcinoma, and gastric carcinoma. And even lymphoproliferative disorders, so like itong mga multiple myeloma, no, mga other types of mga leukemia in immunocompromised patients. So because again, ma-weaken ang immune system. Okay? Alright. Ayan. So that's for the pathophysio. What you need to remember lang, unsa na cell ihang target gyud? The B cells. And unsa na receptor yung gamiton para makasulod siya? CD21. Diba? Recall unsa itong mga CD, cluster differentiation, mga markers for B cells, diba? 19, 20, 21, 22. Diba? Okay. Okay? Alright. Ayan. Okay. Now we go to the different EBV antigens. Okay. So we have the early acute, the late phase, and then the latent phase. So for the early acute, of course, it's abbreviated as EAR and EAD. So early antigen restricted, early antigen diffused. And then we have late phase viral capsid antigen, and MA stands for membrane antigen. And lastly, the latent phase EBNA. So by the name itself, EBV, nuclear antigens. So these are the antigens found within the genetic material or within the nucleus, the nuclear component of your virus. Your EBNA 1, 2, 3A, 3B, 3C, and LP. And you have also LMP, latent membrane proteins. Okay, all right. Now we start first with your early acute phase. These are, again, by the name itself, early acute. These are the antigens produced during the initial stages of replication pa lang. So, nagpadaghan pang ang virus, so release na siyang antigens. These are known as your early acute phase. Okay, so they are classified according to the location within the cell. Ang EAD found in the nucleus and cytoplasm, and ang EAR is found lang within the cytoplasm. So EAD, di ba recall ang say meaning sa EAD? Early acute, diffuse. So meaning diffuse, nakakalat. So it's found in both nucleus and cytoplasm. Pero kung EAR, restricted lang. So di ba nasa ngalan ra, restricted, so it's only seen in one area. And asa na? Sa cytoplasm. Okay? So early acute restricted lang, restricted. So usara ka area, cytoplasm. Early acute diffused, kumalat. Okay, so it's seen in both cytoplasm and nucleus. Okay. And next, for the late phase, you have, of course, it's the antigens, or these are the antigens that appear during the period of the lytic cycle following viral DNA synthesis. So these are just, so dito na sa later part of the life cycle, sa DNA synthesis na. So you have the viral capsid antigen found in the protein capsid by the name itself, no? And MA is found in the envelope, viral envelope. Okay, so I'm sure kabalo na mo sa difference sa capsid and envelope, di ba? So, yes. So ang VCA by the name itself, capsid, viral capsid antigen, it's in the capsid. And MA, membrane antigen, it's found in the envelope. Okay. All right. Ayan. And the last is the latent phase by the name itself. These are the antigens found in the latent phase of infection. You have EBNA, which are again nuclear antigens. So antigens found in the nucleus, no, that are really sa inner na sa imuhang virus. And LMP, latent membrane proteins, LMP1, 2A, and 2B. All right. Okay. Now, okay. Now we go now to the heterophil antibodies. What are heterophil antibodies? Okay. Heterophil antibodies by the name itself, hetero, no others, phil, loving. Antibodies that can react with similar antigens from different species, no? From two or more unrelated species. Now, your EBV or IM, no? In cases of IM, your patients can also produce a lot of antibodies. They can produce, again, heterophil antibodies. Now, what are heterophil antibodies? These are antibodies that are capable, no? They are capable of reacting with similar antigens from two or more unrelated species. Meaning, humans, ako EBV, buyag. Safe naman po ako mga na, charot. Okay, so, ako EBV. Hopefully safe na sila, no, Mark? Okay, anyway. Okay, ako EBV. Okay, nag-produce ko heterophil antibodies. So, I'm human. Okay. Now, I have heterophil antibodies. These antibodies can react with the antigens of pwedeng horse, sheep, and bovine. Okay? Bovine na origin. And usually, these are of IgM. Yes? Because again, diba, since your EBV targets your B cells, no? So, and B cells produce antibodies, they can be activated polyclonally. When you say polyclonally, it can react with a lot of types of antigens. Okay, even from different species. Ayan. So, that's now the heterophil antibodies. Okay? So, pwedeng sa horse, sheep, bovine, RBC. So, ang akong antibodies, heterophil antibodies, brought about by infection with EBV, IM, na ako heterophil antibodies in my serum. If akong serum ipa-react with RBCs coming from horse, sheep, and bovine, pwede silang mo react. Pwede na agglutination mahitabo. Ganun. Okay? Alright. Ayan. So again, produced by 40% of the IM patients in the first week and 90% by the fourth week. Okay. And usually, we test these antibodies to screen for IM. Okay. Ayan. And they disappear in most patients by 3 months after the onset of symptoms but can be still detected in some patients for up to 1 year. Ayan. So as you can see, medyo ano gid siya, it's really specific din naman for your for the IM, for infectious mononucleosis. Okay. So here are some examples of your antibodies. You have the Forceman heterophil antibodies. By the name itself, antibodies directed against the Forceman antigens. And these are types of antigens discovered in guinea pig tissue and in many animals. Another one is a serum sickness. Antibodies formed in serum sickness. Serum sickness is a type 3 hypersensitivity reaction to animal-derived anti-sera. Diba? Type 3 hypersensitivity, it's complement-mediated na hypersensitivity. You are injected, example, of mga vaccines or like anti-sera, no? Na animal origin, okay? Gikan sa animal. So your body develops a reaction against that, no? Serum sickness ang tawag ana. And the antibodies produced are serum sickness heterophil antibodies. And lastly, of course, IM, infectious mononucleosis heterophil antibodies. These are antibodies that appear in patients infected with the EBV. So this is what we look after, kani mga IM heterophil antibodies. Okay? All right. Now for the next part of the video and the next remaining slides, no, we'll now look into the tests for heterophil antibodies because again, these antibodies are produced during infectious mononucleosis, a disease caused by EBV. And then lastly, the different tests then to determine EBV antibodies lang yun, okay, to the different antigens of EBV, not heterophil antibodies, okay? All right, so I'll see you on the next video, okay.